welcome to Boomer Health at Home. I'm your host, Maggie Ornazian, Director of Nursing at Ameristaff Nursing Services. On today's show, The Rise and Fall of Omicron, we are joined today by Dr. Natasha Bagdasarian, Chief Medical Executive of the state of Michigan. Hello, Dr. Bagdasarian.
Hi, Maggie. Thanks for having me on.
Thank you so much for meeting with us today. I know you are probably very busy as we hear about all of the rise of the Omicron and COVID-19 not going away. I really appreciate you taking the time today.
It's my pleasure to be here.
So, Dr. Bagdasarian, if you could, can you describe your position as basically the state's top health officer?
So my role is really to provide advice, not just to the governor and to the Department of Health and Human Services as far as it comes to all things medical. But my job is also to provide the best possible medical advice to the public. And so that's part of the reason why I really enjoy doing discussions and having calls like this so that I can get the most accurate public health information about COVID-19 directly out to the public.
That's great. Yes. I've definitely made a notice of that since you have taken this role. And as a nurse and a Michigander, I really do appreciate that. It's been very helpful and it's been very informative.
That's very kind of you. Thank you.
So how has the messaging changed from Delta to Omicron at this point?
Well, the pandemic is still here. And what we really saw with first Delta and then Omicron is that the way we were able to utilize some of our tools has changed. And I'll tell you what I mean by that. With Delta, we know that Delta was more transmissible than previous strains of the SARS-CoV-2 virus. That's the virus that causes COVID-19. But with Omicron, it's even more transmissible. And what that's meant is that there's very little leeway. It means that we can't really take the same types of risks. We can't make any mistakes. When we're using our mitigation strategies, we have to really use them as much as we can all the time in order to avoid exposure. And things like masks, for example. So we know that masks work, and masks have worked since the beginning of the pandemic. But some of our messaging around masks has changed a little bit because we're now really talking about well-fitting, high-quality masks. And what that means is a mask that fits really tightly to the sides of your face, no gaps along the sides or the bottom, allowing air to come in, and multi-layered. So really having good filtration, meaning those smaller particles can be caught. And that's how some of our messaging has changed. We also have additional tools that are available that we didn't have earlier in the pandemic. So for example, over-the-counter testing. Over-the-counter testing has become increasingly available as we've moved through the pandemic, still not quite where we want it to be, but it means that we can utilize tools differently as well as we've moved from previous surges to Omicron.
Wow, that's great. So when you were talking about tight-fitting masks, were you talking about something called a KN95 or an N95 mask?
Absolutely. So those are not the only types of masks that work. We're really looking for anything that creates, a well-fitting seal to your face and that has multiple layers. But the type of masks that have been approved specifically for use and have gone through this process of being verified are N95 or KN95 masks. There are other masks that you can purchase online, such as KF94 masks that are from other countries that also have some of those same properties. So it doesn't necessarily have to be a KN95 or N95 mask, but we're really looking for masks that have those same properties. And those are the best masks to wear, especially in high-risk places. So if you're going into an indoor, crowded, public setting, those would be the best masks to wear to really keep you safe.
Okay, that's great. Now, if you have neither of those types of masks that we've mentioned, is it best to just wear some type of covering? Is something better than nothing?
Something is always better than nothing. And there are a few things you can do to make your mask, whatever you have available, as good as it can possibly be. So for example, if you're using a surgical mask at home, what you really want to avoid are those gaps on the side of your face where air can just pass through without going through the layers of filtration. And what you can do is you can do the tie and tuck method, which is something that's on the CDC website where they talk about tying knots on the ear loops to try to keep them a little bit tighter to your face. You can also wear a cloth mask on top of a surgical mask to try to keep that surgical mask pressed to your face. You can also just look for cloth masks that are really well fitting and that have multiple layers. So there are other things you can do if you are unable to find a KN95 or N95 mask.
Okay, yeah, those are some great solutions. Thank you. So we hear a lot about, and you see it all the time, through social media and the news, supporting our healthcare workers. Healthcare is having such a hard time in hospitals, nursing homes. Is the state receiving any specific federal funding that you know of to help and support healthcare workers at this time?
Well, there are some healthcare facilities, there are some hospitals that were really feeling the strain. As you know, in Michigan, we started seeing a rise in cases, not just recently from Omicron, but we've been really seeing a rise in cases from our Delta variant since the early fall. So since September, hospitals have been really overburdened. There's only so much that they could do in terms of postponing procedures and canceling procedures before that caught up with them. And so one of the things that we've done statewide is we have worked with federal partners to deploy some teams that can go and take some of the pressure off healthcare facilities. But this is only a short-term solution, and it's only a solution for certain healthcare facilities. What we really need to do, and when we think statewide, what we need to do to protect our hospitals is we need to stop transmission. We need to bring this surge down and prevent people from getting sick, because the more we put a burden on the hospitals, that means the less there is available care for people who need it for other non-COVID things. If you have a stroke, if you have a heart attack, if you're in a car accident, we want to make sure that you can access the best possible health care.
Yeah, that makes sense. That makes total sense. That was our fear in the beginning. Overloading the ICUs, overloading the hospitals. So in your medical opinion, how does our country rank as far as vaccines compared to that with other countries?
Well, before we talk about how our country ranks, I think we should talk about how our state ranks. And in terms of how we're doing in Michigan, we are behind the national average. So we are not really performing where we should when it comes to vaccination. Now, the good news is that we're not too far off the national average when we look at those over the age of 65. So those who are at highest risk for complications are actually getting vaccinated at a higher rate. And when I have discussions with older adults, when I do town halls with the AARP, for example, I hear a lot of very positive discussion about vaccines. There are a lot of older adults who are excited about getting vaccinated. But what we're seeing is that in our younger age groups, vaccination uptake is lower and lower as we look in younger age groups. And so this surge right now, we saw a really big uptake in hospitalizations and case rates in 20 to 30-year-olds. We saw a rise in cases in children, and it's because our vaccination in those younger age groups are not where they should be. So first, we're seeing this discrepancy by age, and we're also seeing a lot of differences by where you live in the state. And so there are some counties that have really high vaccination rates and some that have really low vaccination rates. And that worries me because it means that those geographic areas with low vaccination rates, those communities are at risk.
Wow. Yeah. Do you know how Oakland County is doing?
Let me pull up the Oakland County data and tell you. Sorry, I don't have all of this off the top of my head, but okay. I can tell you how.
Who would? While you search for that, is the state at this time reporting any type of death rates or infection rates on Delta versus Omicron? Do we know? Have we pinpointed that, or is it COVID is COVID at this time?
So I'll just tell you that in Oakland County, for residents vaccinated, we're at 75.8%, which is pretty good.
Okay.
And I'll tell you one more statistic. So what I am concerned about are areas that have lower vaccine uptake. So if we compare that to Detroit, we've got 46.6% of vaccine uptake. So that's what I mean by there is a lot of difference based on where you might live across the state. And one thing that we've got to understand is the way that this virus transmits. We're not protected as a society until everyone's protected. So long as there's transmission going on, we're all at risk. And so we really need to work with folks who are hesitant about getting vaccinated and talk to them about what are the reasons to get vaccinated. I'm sorry, Maggie, what was the most recent question you had for me?
Oh, no, that's okay. I just didn't know if we were reporting on any type of infection rates or death rates in the fact of, Omicron at this point.
So one of the things to keep in mind is that we don't know which individuals, which swabs are Omicron versus Delta for the most part. So statewide, we're only sequencing a very small percentage of all of our samples. And then sequencing takes 1 to 2 weeks for us to get results back. So in terms of individual infections, it's not really helpful to look at sequencing. The sequencing is done more at the state level so that we can understand what's happening in counties and what's happening statewide. And when we look at our sequencing data from both our Bureau of Laboratories, as well as from some of our partners who are also doing sequencing, we can say that it's about 97% Omicron right now, statewide. And again, there's variation between different communities, between different counties. We can't say if an individual has Omicron versus Delta, but it does seem to be, for the most part, it seems to be Omicron now.
Okay. All right. So I only have a couple more questions for you to wrap up because I know you're busy. What treatment course do you recommend for people testing positive for COVID-19 even with mild symptoms at this point?
So I think it's really important for individuals to know what to do when they test positive, because one of the big shifts in the pandemic right now is that you may not get a call from your local health department. You may not be contacted by someone and advised what to do in your specific case because there are simply so many cases. What we would like to do is make this information available to as many people as possible so that people know what to do when they test positive. The first thing you want to do if you test positive, whether it's an at-home test or a test in a facility somewhere, is you want to isolate. So that means that you want to stay at home, you want to stay away from other people. If you live in a home with other people, try to separate yourself as much as possible. So stay in a separate bedroom, try to use a separate bathroom if you can. If you are going to be in shared living spaces, it's best to wear a well-fitting mask around others at all. And so that type of isolation, just not being around other people as much as you can, should be done for at least 5 days. And then at the end of 5 days, if people are feeling better, if their symptoms are improving, they can go out and be around other people, so long as, again, they're wearing a well-fitting mask at all times. Okay. So the first part is to isolate. The second part is we want you to notify your contacts. So that means, who have you been around? Who have you been within 6 feet of distance for 15 minutes or more from 2 days before your symptoms started or 2 days before you tested positive, and notify those people so that they can watch out for symptoms and so that they can quarantine themselves. So isolation is for people who have COVID. Quarantine is for people who've been exposed to COVID. And then the third part is we want you to watch for symptoms. If you are, feeling short of breath or you have any concerning symptoms, of course, go right to the emergency department. However, if you have mild symptoms, but you're in a high-risk category, you might qualify for some early therapies. And we have some very effective early therapies that are now available. The first is Paxlovid, and this is an oral antiviral pill that's available for people who are in older age groups, who may be unimmunized, or people who have other underlying conditions or immunocompromised. So if you think you fall into one of those categories, speak to your physician about potentially getting a prescription for Paxlovid. The other therapy we have are monoclonal antibodies. And there's one monoclonal antibody that's still effective against Omicron. We do have it in limited quantities around the state. So talk to your doctor about whether you could qualify for that. There are other therapies as well. So talk to your doctor if you think you are in a high-risk group and you might qualify for early therapy. The best way to prevent all of this from happening, of course, is prevention. And so for any of your viewers out there who haven't been vaccinated, now is really the time to get vaccinated. And if you haven't had your booster, this is a really good time to get a booster, because what we have learned about Omicron is that being vaccinated may not be enough to prevent some of these severe outcomes, but being vaccinated and boosted is highly effective against severe outcomes and death. So that's really what we want to tell you. There's a whole lot of things that you have to do if you test positive, and there's a whole lot of consequences that you may develop, or negative outcomes that may develop. But if you can prevent exposure, if you can prevent some of this ahead of time, that's really the best thing.
Yeah. Preventative medicine is key. Absolutely. Dr. Bagdasarian, thank you so much. This has been a great wealth of information in such a short time. I appreciate your time. Thank you so much for everything you do for the state. This has been very, very helpful.
Thank you so much, Maggie. I really enjoy being on here with you. And I hope that this was some good information for your viewers.
This is great information. And again, if you only take one thing away from this today, viewers, please get vaccinated and get your booster. We appreciate your audience at home today and watching Boomer Health at Home. Again, I'm your host, Maggie Ornazian, Director of Nursing at Ameristaff Nursing Services. If you have any questions about today's episode, please do not hesitate to visit us at our website or call us at 248-288-2270. Stay safe and healthy.
Greg Jamian, and I bring you our series on Boomer Health so we can explore together important healthcare topics impacting the baby boomer generation today. As a home health professional for over 40 years, I'm happy to share my team's knowledge as baby boomers seek answers to difficult healthcare questions. This show provides valuable resources, ideas, and tips, and cutting-edge solutions that will improve your everyday life and health. Don't forget to join us for all the other shows in our Boomer Health at Home series.